Okay, so let's talk about your company. Tell us, like, kind of brass tacks. How does this work? How do you run this business and run it successfully? How does it work for the person, paying into this? How does it work for somebody who's trying to receive money from this?
Yeah. So we'll take the example of a single person. A single person will pay CrowdHealth two times per month. The first time is $50. That $50 per person comes to CrowdHealth. It pays all of our bills. That's the only revenue that we get. And the reason we do that is because we want it to be very transparent what money we get and what money goes to other people in the community. Because one of the things we have trouble with health insurance is there is no transparency. And so we take our $50. That's the only place in which we touch the money. There's another additional up to $125 that you are going to send to another person in the community who has a health event. So let's just say Casey, he's out running, playing, soccer, whatever, tears his ACL. And it's he goes to an orthopedic surgeon. Orthopedic surgeon says, you know what, Casey, this is a bad one. It's going to be $22,000. Casey calls CrowdHealth and says, hey, I tore my ACL. My orthopedic surgeon thinks it's going to be a $22,000 surgery. And so we said, okay, well, let us negotiate with him. This actually happened in Austin not too long ago, ACL. $22,000 was it. So we called the orthopedic surgeon. We said, hey, if we pay you if our member pays you in cash on the day of the surgery, will you give them a discount? He's like, yeah, I'll give them a discount. And so I said, okay, well, would you consider doing it not in the hospital, but in the surgery center? He's like, yeah, I'll do it in the surgery center. And so how much would it be if we paid you, or if our member paid you in cash and you did it at a surgery center? He said, well, that would be about $12,000. So we called, and in 1 hour, not even 1 hour, it's more like a 15-minute conversation, got that billed from $22,000 to $12,000. Casey would pay the first $500. We would submit the remaining $11,500 to, let's just say, 115 people for $100 each. And so if those people say, yes, I'll help out Casey, then that $100 goes from their bank account to Casey's bank account. And ultimately, at the end of the day, Casey will have enough in his bank account to go and pay for that ACL tear. So in essence, what we're doing is we're crowdfunding your ACL tear from a group of people who have, raised their hand and said, if anybody in the community has, a health event, I'm willing to help. So we present you one opportunity a month to help somebody out in the community. You can say yes, you can say no. If you say yes, then we transfer that money. If you say no, we move on to the next person until we, figure out a way to get Casey his money. Like I said, we've had somewhere between 9,000 and 10,000 bills that have been submitted. Everyone submitted to the community has gotten paid. Like every bill that the community had the ability to fund got paid. And this is from $50 pediatric visit to hundreds of thousands of dollars in a brain hemorrhage member. And so that's the way that it works. It was so different than health insurance. I'm sure there's questions on it, but it has worked like so incredibly well.
Wow, that's amazing. Okay, so first of all, I guess a question on the negotiation. So part of what I'm paying CrowdHealth for is to be able to negotiate with the provider to be able to, bring that cost down.
Yeah.
You guys probably have learned tons of stuff on how to do that. Like, for example, the hospital versus the surgical center. I didn't know there was a difference between the two. It's a huge difference in cost, but like explain that. Like what the hell's the difference where the surgery is done?
Yeah, the surgery center. So surgery centers are such a beautiful thing because one, nobody likes to go into a hospital. It smells bad. It feels bad, especially post-COVID crap. Like nobody wants to be in a hospital. These surgery centers look more like, Westin hotels than they do hospitals. They are set up specifically to do outpatient surgeries, which is the vast majority of surgeries that are done. So any outpatient surgery, which means you have the surgery and you leave, you don't stay. Although there are some that do inpatient, they're able to do it at probably 40% less, sometimes 50 or 60% less than the hospital is willing to do it for. And so that's the beauty of doing it at a surgery center. So it's same doctor, same anesthesiologist, just you're doing it at a surgery center instead of a hospital, significantly less, tons of savings there.
Are the scalpels 50% worse or 50% less sharp or something like?
No, it takes, well, a couple things is Surgery centers typically only take cash. So you have to pay in cash. And so that takes a bunch of the bureaucratic BS out of the hospital system. And then, the hospitals are basically what they're trying to do is they're trying to do everything under one roof for everybody. And it's just not an efficient model, right? Like the surgery centers, let's say it this way. What if a car manufacturer, and Tesla probably is going to prove me wrong here. What if a car manufacturer tried to manufacture the tires, the engines, the windshield wipers, the doors, the windows, everything within, one, building? It becomes very inefficient because the people who are really good at making glass for the windows are not necessarily really good at making the tires for the wheels, right? And so the same thing happens within, I think, hospitals. Is like these hospitals try to do everything under one roof, and they think it's going to be way more efficient. But in essence, what it does is it does not allow you to specialize in one thing. So, let's look at it a different way. Would you prefer to have a surgeon that does 4 ACL surgeries a day, or would you prefer a surgeon who does 4 ACL surgeries a month or a year, right? Like,
right.
The surgeon who does 4 ACL surgeries a day, they do, 100 a month, and they have seen all the complications. They've seen lots and lots of ACLs. And so they're just going to be better at it. They're going to be faster at it. There's going to be less complications. And so it's just a cheaper environment to do that, is if you have some specialists who can do this. And a lot of times they do that within surgery centers.
Wow.
So that's the reason why, surgery centers are, super inexpensive. But the primary reason is the billing is way less. The administration is way less than these big bureaucratic hospitals.
Yeah, and then the overnight stay is a thing too, right? Like usually hospitals will try to get you to stay like 2 or 3 nights afterwards, and it's usually not necessary.
Totally. Yeah, totally. I mean, I'll give you a perfect example, and this just happened to me. So for people who are following on LinkedIn or Twitter or whatever, a couple of weeks ago, I was hospitalized. Went to the ER. They thought I had a stroke, of all things. By the two hours in, they realized it wasn't a stroke. It was a complex migraine, but they decided to keep me overnight just to make sure. Well, that overnight visit was really, really expensive, as you can imagine. Right before I left, the physical therapist and the occupational therapist came in, and they said, "Hey, we just want to make sure that you're okay so that you can go home safely." And I was like, "What do you mean?" I was like, "You guys told me I had a migraine." And they're like, "Yeah, this is just a formality." And I'm like, "Okay, fine." And they're like, "Can you put on these pair of socks and can you brush your teeth, and we'll just watch you?" And I was like, "Great." So, they're chatting with my wife. I put on a pair of socks. I brush my teeth. And they said, we walked down the hall 20 feet. So I walked down the hall 20 feet. I came back. They were there for 10 minutes. They billed me 6 15-minute visits. Each one was between $300 and $400. So it was about $2,000 worth of bills that they billed me for a formality at the end of my complex migraine visit. And so I'm like, what the hell? Like, and so given I'm responsible ultimately for this bill, like I'm calling, the hospital, and, CrowdHealth will do this on my behalf if I ask them to. Be like, what the hell are you charging me $2,000 for this, this visit that, lasted 10 minutes? It doesn't make any sense as a formality. So, we get involved in those things and help you, walk you through these bills to say, hey, what did they do here? What did they do here? And so we can kind of walk you through that bill, and we'll find stuff that is bogus, and fight with the hospital on your behalf. So that's a service that we provide.
That's amazing. And thank you for explaining the difference, surgeons and hospital systems, and I guess more like the surgical centers. I think of it like, would I rather have a plate of pasta from the Cheesecake Factory that has pretty much every cuisine on the planet, or would I rather go to Franklin's and order brisket when they do 1,000 pounds of brisket every single day? I think I'll end up in the line at Franklin's.
That's a perfect example. Yeah, that's a perfect example.
That's crazy. Okay, now you also mentioned something interesting earlier, where you said there was a limit of for an individual. It's a limit of $125. Does that mean that if I'm paying in, my monthly rate might be variable depending on what is needed in the community, but it will never exceed that?
Yeah, it won't exceed 125. So this month we're asking for 100. I think next month will be a little bit lower than that. And it's variable based upon, what is going on in the community that month. So this month we had a couple of NICU babies. We have a non-Hodgkin's lymphoma case. Like we had some legit, cases this month. So we had to bump it up a little bit. And I don't foresee that happening next month. I probably think it's going to come down a little bit. So it does, what we say is for people is like budget for 125. And then if it's less than that, celebrate, go and take your, wife or husband or whatever out to dinner, or, invest in Bitcoin, or, do whatever you want with that money, because we're never going to ask for it again. It's yours. Keep it wherever you want, spend it, save it, whatever you want to do. We're never going to ask for that. So we only ask for people to help for the events that happen in that month.
I see.
And so that's why it's a little bit variable. And some people are kind of like, oh, I wish it was just the same every month. I'm like, look, budget for 125 and celebrate if it's less.
Yeah.
You just got free money. And so, and most of the times health insurance plans, they keep that extra money. They put it in a big pool, which, with inflation, the value of that is going down. They will sometimes invest it and get interest off it and all that kind of stuff. And guess what? You don't get that. The health insurance plan gets that. And so we're like, man, you keep your money, you do with it what you want. You get benefit from that, as opposed to, any corporation getting benefit from that.
Yeah, interesting. Okay, so if I'm paying in, do I know exactly where my dollars are going? So like if it's October, the fee is $100 this month. Do I know that I'm helping Tony in Cincinnati, or do I know that I'm helping the community at large? It goes into a pool that pays out all the claims evenly.
Man, yeah, great question. And I think it's our biggest differentiator versus health insurance. And so we will send you an email once a month. It's going to be converted to our app here in the next couple of months, but we'll send you an email. We'll say that, a male in Salt Lake City tore his ACL, and he is requesting, $100 or whatever for, his ACL. And so you can set up that setting to say, automatically approve that or automatically deny that or whatever. So there's some settings in the back end that allow you to automate some of those things, but exactly where your $100 is going that month. And so, as opposed to sending it to this big corporation, United Healthcare, where you have no idea where it's going, your money is going directly from Casey to Andy or Mary or Amy or whatever, to help them with their health event. We do not get in the middle of it. We don't touch it. It's a peer-to-peer transaction. And that's a super cool thing. One quick story is we had a woman, which one should I tell? Because there's so many. Well, a few months ago, we had, probably 6 or 9 months ago by this time, we had a woman who had a miscarriage and had some, complications and had some medical expenses. And so we sent out a request, and we had a bunch of women, I think there was like 3 or 4, that responded and said, hey, this is a part of my story too. I had a miscarriage. I know what this family is going through. Can I, instead of $100, can I give her $200? Because I want to help in any way that I can. I'm like, I was blown away, because I was like, never in a million years would you, call your health insurance plan and say, can I give an extra $100 this month? Like, it just wouldn't happen, But the way that we say is we say fund humans, not health insurance. Like, your money is funding other human beings, as opposed to funding big health insurance corporations. And so we think that's the beauty of this kind of peer-to-peer funding. And it's very, very different than, sending a check to United Healthcare.